Full of time. So for those of you who don't know me, my name is Arabella Pluta-Ehlers, and I'm the Program Manager for Children, Youth, and Families here at the National Association of Counties Research Foundation. We're very excited to be hosting another round of our virtual peer learning network series, which focuses on county level leading innovations and strategies for expanding high quality services for young children from prenatal to age 3. We created these networks for counties to have a virtual interactive space to engage with peers on prenatal to 3 topics. In today's discussion, you'll hear from both national and county experts, and we'll be exploring strategies to support home-based childcare providers. And these prenatal to 3 peer learning networks are a part of NACo's Counties for Kids initiative. The slide you're seeing now has a few of our resources. You can find all of our resources at countiesforkids.org. But Counties for Kids is our public awareness campaign for county leaders who are committed to making investments in young children prenatal to age 3. Through Counties for Kids, we offer free online tools and resources that are available for all counties, no matter where you are in your early childhood journey. And like I said, you can find these all on our Counties for Kids website, which there's a link to in the chat. And I also want to take a few minutes at the start of today's session to share a new resource that we have recently launched called the Counties for Kids Neighborhood. The neighborhood allows county leaders to connect on a virtual platform to ask questions, share best practices, and virtually learn from experts and each other. This neighborhood will be focused exclusively on county's needs, challenges, and opportunities. And our goal is really to provide a safe space for questions and peer learnings. We're hosting it through the National Collaborative for Infants and Toddlers Exchange platform. So to join, you'll need to create an account on the exchange. You may already have one, but if not, it's super easy. There's a link on the slide that will be, that was just put in the chat and that I'll share out afterwards as well. But you can just visit that link and create an account. You'll be prompted to choose a username and password. And then as you click through the platform, you'll be invited, or there'll be a space where you can request to join the Counties for Kids neighborhood. And I have a more kind of in-depth guide that I'll be sending out in our follow-up email today, just to kind of walk you through it step by step. But just please know that this resource is out here and it's open to everyone doing work at the county level. And we really want it to be a space where the conversations that we have in these peer learning networks can continue. So along those lines, there's a discussion post that I put up there now. When you visit the neighborhood, you'll see that you can kind of start a discussion, respond to existing posts, or share your resources or upcoming events. But just to kick us off, I created a discussion question about home-based childcare and this week's peer learning networks. So after our conversation ends today, you'll get the email with the guide to the neighborhood, and I encourage you to log on, visit this post, share kind of your takeaways, questions you still have, things that are happening in your county, just to give us a chance to keep this conversation going even after today's session ends. So just quickly before I hand it over to our speakers, quick review slide for everyone. Please note that today's meeting is being recorded. And you'll see on the screen some reminders about muting and unmuting, raising your hand, all of those Zoom functions. And we'd like to test the chat out now to learn more about who's joining us today. So if you could just take a minute to share your name and county in the chat so we know who's here. And throughout the run of the show, we kind of ask that you remain muted during the first half when our speakers are presenting. While they're presenting, you can continue to use the chat to engage with the presenters and with each other, to ask questions or react or share your experiences. And then for the second half of our convening, we'll open it up and have an engaging and interactive discussion between all of us here in the virtual room. This is really a time to learn from each other and share best practices within your county. We want you to engage with the speaker and with each other, and we encourage you to keep your video on, particularly when you're speaking. You can share ideas and questions in the chat, but we suggest unmuting and sharing your question aloud with the group so that we can really get a dialogue going. And throughout the discussion, you can use the raise hand function to indicate that you'd like to share, or unmute yourself and begin speaking. We have a smaller group today, so we can probably keep it pretty informal, and folks can just kind of chime in as they have things to share. If you experience technical difficulties at any time, you can send a message to me directly in the chat or to my colleague, Alana Hurley. Thank you to the folks introducing themselves. We're glad to have you all here today. So to start us off, just to help with the level setting, I'd like to share a poll about, one second. Alana, can you help me out with launching this? We have a poll that is in progress about kind of where you're at with your relationship with home-based providers in your county. And you can respond on the poll or share in the chat kind of if you feel like your connection is very strong, improving, or developing. No wrong answers. And if none of these really fit, then you can share kind of a better description in the chat as well. We know that, home-based care can be hard to make those connections and identify where providers are. And that's definitely something we want to be thinking about in our conversations today. So I'll give folks another minute to respond to that and just share kind of what our agenda will be. We're first going to hear from Natalie Renew, who is with Homegrown, who will be doing some level setting about home-based childcare, the landscape before and after COVID-19, and strategies that we can use to support these providers at a very high level. And then we'll move into our county presentation and hear from Montgomery County, Maryland. And then, as I said, we'll have a good 25 or 30 minutes for questions and interactive discussion. So I'm going to go ahead and share the results. Looks like we have folks kind of all over the board, which is great. Plenty of chances to learn from each other. So with that, I'm going to introduce Natalie. Natalie is the Executive Director of Homegrown, a national collaborative of funders committed to improving the quality of and access to home-based childcare. Homegrown is working to remove policy barriers, strengthen home-based childcare practices and business models, and support the growth and recognition of the sector so that all providers offer quality care and parents choose quality care. Prior to joining Homegrown, Natalie led the expansion of the Early Childhood Education Group at Public Health Management Corporation in Philadelphia. Natalie has overseen the development of large programs, secured sustaining funding for major initiatives, and supported local systems change in the early learning sector. Natalie, thank you so much for being with us today, and please go ahead and get started.
Thanks so much, Arabella and Rashida, for including me in this conversation. It's really wonderful to be with you all today. And I'd love to acknowledge Kathy, our one of the founding Homegrown members at the Pritzker Children's Initiative. So, excuse me, I'm really thrilled to be here with you today. The way I've designed this PowerPoint is it's got lots of information for you to look at in your own time. So I'm going to move through it pretty quickly, but there's lots that we can go back to in our discussion. Excuse me. We can go to the next slide. So just to kind of ground us in why we're so focused on home-based childcare as an initiative is that it's where a lot of children are. Nearly 7 million kids are in this setting. It's where most of babies and toddlers are. And it's also where a lot of the children who we care deeply about, those from low-income families, children of color, children in rural communities find themselves. And despite that fact, home-based childcare has largely been sort of under-investigated, under-resourced, and gets very little of the interest, innovation, and resources that are in the early childhood sector. And that's really why Homegrown exists, to really shine a light on this care and to really ensure that this care gets both the recognition and the resources it needs to be successful. So we can go to the next slide. A little bit of why families are here, what families are going to home-based childcare for. This is a setting in which families have trusted relationships with providers, where there's a shared culture and language. This is accessible, often more affordable care, and it accommodates complexities of parental employment like non-traditional hours. When we are talking about home-based childcare at Homegrown, we're thinking about this broad continuum that includes licensed family childcare, small businesses, but also this vast and diverse group of family, friend, and neighbor providers who are kind of on a continuum of being small businesses through just grandmoms and aunties and neighbors who are helping families meet their childcare needs. And, you know, we've seen particularly some key drivers of demand during COVID are the perception of safety, that this is where small groups with consistent caregivers, you know, are, that there are prior and existing trusting relationships that are helpful. And again, this kind of flexibility as we've seen so many changes both in the status of employment and the nature of employment over the past 2 years. Next slide, please. So things weren't great in the home-based childcare sector pre-COVID. You know, we've seen for, you know, well over a decade kind of a declining supply of family childcare. We also, you know that this is a sector that where the workforce is, you know, really struggling. Home-based providers work, you know, 56.5 hours a week, and most have a, you know, an annual pay. Most licensed providers have an annual pay of just under $30,000 a year. And sort of again, within this larger context of early childhood, that compensation is even worse than what we know is not a great situation in center-based care. A lot of these challenges around kind of participation and accountability we attribute to sort of a sector that is very center-centric. So a lot of the standards, our ideas about quality have really been defined based on what we understand to happen in center and school-based programs. And there are many indicators, but I think this indicator around the access to health insurance is, you know, just sort of a clear reminder of how marginalized this workforce is in our broader community. Next slide. And sort of on top of that, COVID, you know, made things a lot worse. So, you know, during the pandemic, and certainly many of these issues continue to persist as we go into whatever phase of the pandemic we're in right now, but you know, concerns around health, concerns about the families that home-based providers are serving and the many hardships that they encounter, health, mental health, and financial. We really saw this kind of triple whammy for home-based providers with, you know, changes around their revenue, whether that's because of closures or enrollment changes or parents' ability to pay changing, increasing costs to meet the new requirements of keeping children and their own family safe, and then limited access to public support. So we've really been sort of tracking a story where despite their best efforts, many home-based providers have been unable to fully benefit from, you know, public relief efforts. There have been other issues around just challenges with getting access to information, the fit and the sort of nuance of rules as they apply to home-based care has been particularly challenging. We've started to see things like food and housing insecurity. And then, you know, for a subset of home-based providers who are those family, friend, and neighbor providers, they have been very intentionally excluded from many of these supports, and we've seen even worse outcomes for them during COVID. So, you know, I think like the backdrop of many of these challenges, what we saw during COVID as well was just a significant kind of increase in reliance on home-based care. And especially in the early days of the pandemic, home-based childcare really was the backbone that ensured that essential workers could continue to work. So as we've been thinking about solutions, you know, we can go 2 more slides forward, Arabella. We've been really thinking about the opportunity for public financing to support networks of support for home-based childcare providers and really create durable infrastructure through hubs that can get information, resources, and financing to providers, and have been working with partners like Montgomery County, who, will speak in just a couple minutes around thinking about how to really do that in a way that is intentional and supports home-based providers. We can go over to the next slide. And so this is sort of a conception of these networks, but essentially where there are hubs that are community-based with deep relationships with providers who are able to get quality supports, business sustainability supports, and comprehensive services supports, health, mental health, and disability supports to home-based providers in a regularized, ongoing way that's publicly financed. There's a lot of complexity in this chart, so I'm just going to drop a couple of links in the chat where you can go and find additional resources related to this, because there's a lot to unpack, but we have a lot of publicly, totally open source resources that you can access on this site, and would love for you to do that. We really see kind of networks as kind of that structure, that connective tissue that helps providers connect with government and other key resources. And so, I don't think that we have time to dig deeply into some of these ideas right now, but hopefully can revisit during the chat. But, we really see opportunities for communities, really led by government, to think about building supply, improving quality, and securing the financial and economic stability of providers, using a method like, networks as a way to get those types of resources to providers. So I know that I don't have much time, but I wonder, Arabella, if you would mind just advancing a few slides to the building supply slide. So again, in this presentation, you'll have all these links so you can go back and see all of this, but we really see an incredible opportunity in this moment to expand the supply of home-based providers. One very obvious and quick way to do that is to recognize the providers that are already here doing this work, and to really kind of see and include family, friend, and neighbor providers as a part of the system. But there are also, opportunities to support those providers in becoming licensed, and for licensed home-based providers to expand to serve more children safely. We can go to the next slide. With public investments, especially at this moment, there's an incredible opportunity to really think about more quality supports for home-based providers, and to really use strategies, modalities of reaching these providers, like home visiting and curriculum that has been developed for them, not just for centers. That's been kind of watered down a few times over. So there's a real opportunity to make investments and to elevate quality supports for home-based providers. And then lastly, we can go to the next slide. What we've really identified is that there's this incredible opportunity to really address kind of the fundamental weakness in the sector, which is that providers of all sorts are really economically unstable, and that is leading to turnover and churn and undermining the well-being of these providers who are so critical to support families. And so we've been really thinking a lot about how to support providers in getting fair wages, accessing benefits, and the critical supports they need so that they can continue to show up for families. So I'm going to stop there, because I really want Jennifer to have some time to share more about the incredible work that's going on in Montgomery County, but really happy to revisit, some of these ideas in our discussions and our Q&A. Before I turn it over to Jennifer, I do want to just do a little bit of plugging. Homegrown is going to be recruiting a cohort of county and state administrators to support as they think about building comprehensive networks on behalf of providers. Jennifer has participated as kind of our first cohort in this, so I'm just dropping something in the chat if you all are interested to consider participating. And with that, I'm going to turn it over to Jennifer Arnaz at Montgomery County, Maryland. Jennifer is the manager of the Child Care Support Services for the county and provides oversight and administration of the Child Care Support Services. She works with the county and other community stakeholders to develop and implement strategies that support the childcare workforce and improve the quality of childcare in Montgomery County. Thank you so much, Jennifer. I'm excited to turn it over to you.
Thank you, Natalie. So good afternoon, everyone. Yes, my name is Jennifer Arent, and I oversee childcare support services that holds our childcare resource and referral center. It holds our childcare and public space. We have 29 programs in county public space. We also have the infant and early childhood mental health program, as well as a family support center. So talk a little bit about the family childcare initiative that we have. Over the past 10 years, we know that our jurisdiction has increased in the number of residents. We're over 1 million residents in Montgomery County, which of course means we have more children. What we also know is that we've declined in licensed family childcare providers by 20% over the past 10 years. So we know that childcare is a necessity, it is essential. But we were really lacking the number of seats or slots for these children in licensed childcare. We were doing a lot of focus groups with our family childcare providers about 8 years ago to find out why they were leaving the field. Many of the reasons that collided together were really about age, just getting older and wanting to do something else. The requirements, if you think also the past 10 years, there's been a real push with quality rating improvement systems for childcare to reach certain quality benchmarks. And that pressure of additional professional development, additional certifications and credentials was becoming quite the burden for many family childcare providers. And the last reason they were leaving was enrollment was declining. They just were not finding that they were able to afford to operate a program with so few children. So at the same time, we did some focus groups with our families to find out what they were looking for. And really families were looking towards unlicensed childcare because of cost. That was the driving factor. So we wanted to find a way to really merge the two concerns and help build up our regulated family childcare programs in Montgomery County. And we did this through the work with the Child Care Resource and Referral Center. We were very fortunate in 2015 that our county council enacted a bill called the Early Care and Education Initiative. And that really helped to support what we were doing in the field and with the Child Care Resource Referral Grant to really do the recruitment and retention effort of our family child care. In 2017, there was additional funding that was brought on board to our direct services so that we could hire permanent staff. So we formally launched Go FCC, which is Growing Opportunities in Family Childcare. It is focused on both recruitment and retention and provides support to family childcare in a very comprehensive way. Next slide, please. So what we did know is that we wanted to increase, very basically, we wanted to increase the number of family childcare that were licensed in our jurisdiction. Montgomery County is a very large county. And so we tried to narrow that down a little bit by looking at where the gaps were, where there were deserts, where did we see the highest need or vulnerable populations. And we targeted 5 zip codes in our jurisdiction. We also know that in terms of retention, we wanted these programs to have resources and supports so that they could reach quality rating improvement systems, which in Montgomery County or in Maryland is called Maryland Excels, at higher levels. By doing so, by being levels 3, 4, and 5, this enables those family childcare providers to also receive a tiered reimbursement for children who are accepting subsidy. So that was an increase in enrollment fees that they could collect from the state. Between the two, we also knew that in order for family childcare to be successful, we had to provide support for business sustainability. And so we made a very conscientious effort to really look at the business model that family childcare provides, follows, and see where it is that the supports needed to be in terms of what was the financial literacy that they were entering the business to, and what were their goals in terms of budgeting, record keeping, and marketing. Next slide, please. So our overall network, as Natalie had said, we did participate in the homegrown pilot program. And so we benefited from many, many resources. One was to hear from other jurisdictions throughout the United States to see how they were working and focusing on supporting the family child care community, both in the regulated and informal settings. The model that we have really focused on is to look at the funding that is available to us, as I said, through our initiative from County Council and our county executive, who are very much supportive of this initiative. We have funding to have staff, full-time employees, as well as the Child Care Resource and Referral Grant to focus on the retention and recruitment piece. So we do focus on the licensure. We focus on moving them through the quality rating system, and we look at the business sustainability. Through our making sure that our policies are aligned and we have the resources available to be able to support these hubs of family child care providers that go through a cohort system of training, through networking and continued support. Those family child care providers, once they become licensed and have a few years under their belt, can also become mentors and ambassadors for our program. And so the cycle repeats itself, where they are going out into the community, recruiting, informing, and sharing about the different resources that are available to them through Montgomery County government. We've also collaborated very strongly with our 2 family child care associations, who are key really in terms of communication and ensuring that there is trust building in the community, and that our family child care providers have multiple avenues where they can find these resources. Next slide, please. So key considerations, I'll go through this quickly because I know we have time. Key considerations for us, as I said, having the staff that's available, but also knowing where our strengths lie and where the partnerships lie. And we knew that the business sustainability was a key factor for this to be successful. The business model had to be reviewed and renewed. And so we entered a contract with the Maryland Women's Business Center to have a full-time dedicated counselor that would work with our family child care providers in creating budgets, in creating record-keeping formulas, as well as marketing plans. The supports that we provided were individualized business consultations and group sessions where we'd review those 3 areas of record keeping and marketing and budgeting, and technical assistance with any application processes that were necessary, whether that was for grants, loans, or for looking at creative ways of crowdfunding for their program. Programmatic supports focused on really the curriculum and the educational component of their family child care program, and finding ways to help them really maximize the benefits that they each uniquely bring to the field. One of the things that we do consider is that each family child care provider has the resources necessary to help them really enhance what they offer. We have a very diverse community in Montgomery County. I believe it's like over 168 languages are spoken. The reality that within our family child care community, the majority are Spanish speakers. And so everything that we offer is in Spanish and in English. So we look at curriculum supports that will help both culturally and that meet the Maryland requirements for quality assurance and accreditation. We also provide funding so that we can purchase supplies for the program, from basic essentials such as first aid kits, diaper changing tables, making sure that they have what's necessary to operate the program, to more enhanced, for example, whether that's shelving or rugs or actual dolls and materials and such. We also provide all the professional development. And I need to say this very clearly, everything that we offer is free to our family child care providers. This is 100% funded by our county general funds. The professional development that we offer to the providers is all the license required courses. And upon completion, we also pay for their first year dues within a family child care association. We've also collaborated with other partners in our county, and being part of the county government, we're able to tap into these resources. So we offer English classes and technology classes. One of the things that we found out that was very evident when we started to formalize our quality rating improvement system in Maryland, everything went online. And so submitting documents, scanning, completing applications was a challenge for many because there was the technological literacy was very low. So we worked with a community-based partner to offer courses in how to operate on different Google platforms, as well as Microsoft platforms, as well as another foundation to be able to connect providers in purchasing refurbished laptops so that they could operate their business with that. Next slide. So the family childcare has two tracks, recruitment and retention. And this is really the grit of the program. For recruitment, we were able to reduce the time frame to obtain a license in Maryland. Formally, it would take individuals anywhere between 9 to 12 months to get a license, because in Maryland, the process for licensure is not linear. It is multiple things happening at the same time. So we were able to assess that and work with our association about lessons learned, what providers in the past have experienced, where the delays were, as well as bridging connections and relationships with the different partners, such as permitting, criminal justice information systems, so they can get their criminal background checks, and then formalize a pathway for them to get their license in a very short amount of time. It's concise and very intentional of what the information that we provide them. Once they become licensed, then it goes into the retention phase. That track, it could take anywhere from 1 to 3 years. We help them with launching their business. We help them with an educational pathway, whether that's credentialing or higher ed. We also look at accreditation and participating at higher levels of the quality rating improvement system, and make sure that their programs are continually supported through the county, through the state, and other initiatives that we have throughout the available to them through Maryland. So at the end, we are very successful in this approach. It is very personalized. We are very conscious also about providing the support in Spanish and in English. We are a trusted entity in the community. And I think really that having that one-on-one personal approach and having our graduates, let's call them, be our mentors and ambassadors really helps to build that relationship with the community, so that they see us as a trusted source of information and not fear the county government coming in and with these supports. Next slide. So I gave a lot of information in this short amount of time, but I hope that we can engage in some discussion now about what both Natalie had spoken about, as well as more centered into how the practice was in Montgomery County. So let's take a minute and pause and sort of digest all the information that you heard, very condensed and quick. But based on that, I guess the first question really is, is anyone really doing work in their jurisdiction right now that is supporting family child care? I'm assuming people can unmute at this time. Arabella, can you pop up the poll results again? Because I'll be honest, I didn't capture it all.
Sure.
I know that we were sort of all over the place, but I believe there was a chunk that said, yeah, they were able to identify where HomeBased is happening right now. So I'm curious to hear what people are doing right now in their communities. So we're an intimate group. Feel free to unmute and come on to the camera. Is anyone doing anything similar in their jurisdiction? Or are there any questions also about what Natalie has presented or what I presented?
Jennifer, I have a question, and people who know me, I can always be counted on for a question. I was kind of curious, like what you're finding in Montgomery County of home-based providers who, for different reasons, either cannot get through licensure or don't want to be licensed, and sort of what support for that population of home-based providers look like for you.
So 2 points. The biggest barrier that we're finding for those who want to become a licensed family child care provider in Maryland is the immigration status. Having a Social Security is what is requested on many of the forms. And there has been a lot of talk over the past year with legislators to look at the rationale behind that. There was a lot of change that happened with the Department of Justice and federal changes in terms of having fingerprinting and criminal background checks on providers. This is still, there are some states I know that have been able to work around that. In Maryland, we are still in the discussion phase. So being able to proceed without a Social Security, really, it's not going to happen. So that's the largest barrier. And we don't really have a resource at this point other than sending them to other community stakeholders who can support the individual with pursuing an immigration status that's legal in this country. Another reason that individuals may not want to go the licensure route, so they have all the, they meet all the requirements, but they choose not to go that route, really is because of the requirements that Maryland exceeds for obtaining a license. At minimum, to become a registered provider in Maryland, there's about 48 hours of training that is required. And it really is about an investment of approximately $7,000 that the individual has to make. There are things that, smoke detectors have to be hardwired. And so if it's an older home, that's going to be a cost. The health and safety requirements from fire marshal in terms of the size of the windows, things like that have to be egresses. Are there sufficient amount of egresses that may have to be modified or built? Having an enclosed backyard is another one, so fences. So what we've been able to do is try to figure out where those costs lie and how can we offset that. So we've absorbed the cost of permitting for a home. We've from the fire marshal, which is approximately $208. So we've absorbed that cost so that they don't have to pay that. We provide some funding that will offset any major structural correction that has to be done, such as the fencing or the windows, as I said. But it's limited. I mean, I will be very honest, it's not that it's 100% paid, but it's to offset some of that expense. So that's one way that we've supported those individuals if they say cost is a barrier. In terms of the cost of the classes, like I said, there's about 48 hours of coursework that needs to be completed, including CPR and first aid. We provide all that for free now. So we try to offset those expenses by offering those things to the community. And then the third piece is it's a lot. It's a lot to become licensed in Maryland. And so we have really relied on our mentors to be that peer support and help people through each step of the way and support them with templates. So it's just filling in the blanks with what makes their program unique, so that the burden really isn't on, I have to fill out all these documents, but it's really about, okay, what makes me unique, and try to really encourage that business entrepreneurship as well. So I think those are the big pieces that we focus on.
It looks like there are a couple of questions in the chat for you, Jennifer. Maybe I'll pose them. Anne asked, what was the public budget that was needed to run the Go FCC program, and what other resources were tapped to support the project?
So officially, there was about $250,000 added to our budget for Go FCC. I also have, as I said, 1.5 FTEs, but we also use a portion of our child care resource and referral grant for that, so that in terms of staffing and the resources that we provide. Other resources that we've tapped into, the state also has grants that they put out for new registered providers. And so upon completion of their licensure, they can get a reimbursement. So it's another avenue. And then for the retention piece, we've also tapped into our quality rating improvement system, has credentialing for providers where they could, depending on what level they're at, they can actually receive funding for training and additional resources that way. But yeah, so we look at our partners as well. As I said, we tapped into a couple other stakeholders in the community. One, Phoenix, who takes refurbished computers. And so we were able to get into their into their network and be able to connect our providers with free laptops or low cost laptops. Nothing is more than $100. So yeah, we just try to build these resources as best as possible. The public library is also another one. It is not in our department, but it is a county agency. And so using some of their resources as well to help with GED and learning.
Jennifer, maybe you'd be willing to share a little bit about some of the wealth building activities and home ownership activities that are available to participants in the cohort?
Sure. So one of the aspects that we were very proud of when we first started our Go FCC formally when it launched. So as individuals are pursuing their licensure, I'll be very honest, many of them come to us with not having a permanent address, whether that's they're renting or they're looking to move somewhere. They may be an apartment and they want to move to a townhouse. So we started realizing that many of them were looking to rent, and the cost of living in Montgomery County is quite high. And based on their income, they did qualify for moderately priced dwelling units. So we connected with the agency that supports that. And there's training that's involved. You have to attend classes and then fill out applications. And so we provided some one-on-one support to individuals who were able then to qualify for these MPDUs and have homes. And these homes, are throughout the county. And as you recall at the beginning, I said we focus really on 5 key zip codes. We have 2 women who actually are in one of those 5 zip codes. And so they were able to access those homes, which has been a remarkable life-changing event, really, to be able to affect, their home and their livelihood, because now they're homeowners and they're business owners. One of the pieces that I stress with Go FCC, family childcare, is predominantly a female dominant career choice. And so we really look at the female empowerment, women empowerment. And so one of the pieces that we look at is they are entrepreneurs. And so helping them to really create these businesses and be the CEOs or presidents of their companies and operate it so. Many of the women are foreign born, Black and brown women who are entering this field for the first time, who enter probably because they want to stay home with their children. And so now we've opened up the world for them. And so by giving them these opportunities, it just really shows a lot of leadership. And what we want to do, sort of the next phase with Go FCC, is really to raise these women to be the leaders in our jurisdiction, to help others in terms of not just within family childcare, but speaking and having their voices heard and being part of the decision-making that occurs when it comes to early childhood and education. And in regulation and whatever aspect that our state moves forward in with early childhood. We want their voices to be shined and heard.
It's awesome. It's really, I think, kind of gets to this piece of economic stabilization, which is not just income today, but the sort of long-term wealth building that's so critical to creating stability in the field. So I see there's some questions in the chat, but because we have some friends on the call, I'm going to pick on them. And I wonder if Lori or Megan from Onondaga County would like to jump in here and share a little bit of the work that they've been doing in New York, also focused on really building support for home-based providers.
Sure, thanks, Natalie, and I'll get us started and then I'll kick it over to my colleague, Megan. I'm Lori Black, and we're the Early Childhood Alliance in Onondaga County, and we too are part of the Homegrown Initiative. Montgomery County is a little bit further ahead of us, and so we admire what they're doing, and we're obviously learning from them as well, and that's why we're on here today, because we wanted to hear it all over again so that we could say, what parts of those things should we be doing? But we're kind of in a more beginning stage where we're beginning to think about, and I guess I would just say Homegrown has been incredible in broadening our understanding about what we have to do to co-partner with home-based providers as we build a stronger, more effective early childhood system. So I highly recommend going to Homegrown's website, checking out the resources, reviewing the different resources that are there and highlighted as best practices and evidence-based programs to support family childcare or home-based childcare. But I am going to toss it to my colleague, Megan, to talk about what we're doing in Onondaga County, and we're, like I said, we're kind of starting at the beginning and doing focus groups, but we also have a strategy that right now is doing coaching with our family child care providers. And so she can talk a little bit about CCQI, as well as the focus groups that she's right now in the midst of facilitating. Megan?
Thanks. Yes, I actually had my camera off for a minute because I was just talking with a provider who unexpectedly dropped by to want to talk more about their focus group, which is fantastic. So we are in the middle of a childcare landscape analysis, really trying to get a baseline understanding of where childcare is in our community. A large part of the analysis is focused on supply and demand, and we've been contextualizing that information by really talking with providers around the barriers and challenges that they're experiencing as it, kind of pertains to specifically being a home-based childcare provider. Like, we know life is hard, but how specifically is that impacting you as a provider here? And then what do you dream for yourself and for our community as we build community connection and capacity on behalf of home-based providers? So we've been holding a series of focus groups, which has been really interesting. A lot of one of the things that we're hearing from providers, the two themes that at least at first glance keep coming up over and over again, is helping parents as it pertains to things around safety, and safety with COVID, but also safety in terms of what does it mean to be you're such a trusted part of our family. How are we really thinking about safety more collectively? What does it mean for providers who are located, our home-based providers in challenging neighborhoods? And what does that feel like? What does that look like? And how do we best support them in being a safe haven for the families that they work with? So that's a big theme, as well as really, what we know to be true, building connection and community in a way that is systems focused, but also is person to person and personal and mentorship and these kind of different, avenues. So that's a lot of what we've been hearing with our focus groups. And I think which kind of dovetails nicely into our childcare quality improvement pilot initiative that we've been running. This is funded by our county executive. And these coaches go in and work with our providers, bringing in creative curriculum and, a whole suite of supports in that sense, as well as really being a mentor and a friend and a partner to providers, and thinking about both from a small business perspective, as well as a quality education perspective, how are our home-based providers getting supported in a really, intensive wrap our arms around approach to delivering really high quality care. And so, how are providers supported, as well as how they're supporting the kids in their care.
Awesome. Thank you so much for sharing and for that shameless plugging of Homegrown. I really appreciate it. I wanted to bring others into the conversation. It looked like Mary Jane maybe earlier was going to ask a question. So I want to go back and see if Mary Jane would like to come off mute and ask her question.
Thanks for calling me out, Natalie. I appreciate that.
Sure.
I am new to this this forum, and I so appreciate the journeys that all of you are taking and your generosity in sharing that with us. I'm talking to you from Porter County, Indiana, southernmost tip of Lake Michigan. And we are focused in our initiative, First Things First Porter County, on that 0 to 3. So I've been reading about a lot of the work that you're doing in Onondaga County and around the country. I have a very basic question, and I feel like Ann Mack's question started to address it, but we're really starting at the very beginning. And that is even connecting with our county commissioners to convince them, to persuade them that this is worthy of their attention, first of all, and hopefully deserving of their investment. So I'm looking for any thoughts, advice that you all, if you can kind of think back to the very beginnings of your journeys and where you were in terms of engaging your county government officials.
Great question. Jennifer, do you want to take that one?
Yeah, I'm just trying to put my thoughts together. So I think first and foremost is stressing it really is an economic imperative that we are supporting our early childhood field and really looking at the impact of those first 5 years. There was a lot of education that went on prior to 2017 in terms of the importance of positive environments, supporting families. You know, if one thing we learned during this pandemic, right, is how essential childcare is, and really focusing on focusing on the experiences that those young children are having and what the outcome will be when they're ready for kindergarten. One of the mantras we have in our jurisdiction is that birth to 5, we're not just helping them getting ready for school, but we're getting them ready for life. And so those skills are essential. So having that conversation about not just the research, but the reality of it. And I'll be honest, one of the other things that we did is we took our council and stakeholders to visit childcare programs and like be there and do a tour of what our programs did during the day and how the children were benefiting from these environments. So that was, I think that really was a turning point when we went to visit.
That's great, Jennifer. And I would just offer here, Mary Jane, that the community that NACo is facilitating and the NCIT platform is a really great place to get some of those case-making resources from them and from peers. That's a lot of the type of communication that happens on that platform. And it's a really great place to say, I'm having a meeting with some council members, send me, you know, your one-pagers or your ideas on key messages. And I know the community will be super supportive of you there as well.
Yeah, thank you all. I appreciate your thoughtful responses.
So I think we have time for maybe one more question, or can reflect a little more on one of the discussion questions, but would just like to open it up and see who else has a question for Jennifer or Megan or Lori, or would like to share more about the exciting work happening in their community.
So I will put a plug in for Homegrown for those for jurisdictions. Really, I do want to highlight that, because having done the work, in our state, in our county, and I probably should also share that our model Go FCC has now been funded by the state to replicate in 3 other areas, both in urban, in a rural and suburban areas. So we have three pilots that are occurring throughout the state to model what we did with Go FCC in Montgomery County. And, we're very proud of the work we did, but I feel that we really grew even more having participated in Homegrown, because to hear what others are doing and really learn, lessons learned, I think was essential for us to be able to continue our growth and to evolve. I mean, we really want to be able to continue with the supports that are meaningful and look beyond just the childcare piece of it, but look at other aspects that are impacted as well. So I definitely put a plug in for Homegrown.
Thanks, Jennifer. And we welcome any county that's interested in participating. All of the materials are available to you on our website and are totally, yours to use and rebrand however you like. And then, we will have another cohort starting later this spring if you're interested to join in a planning cohort to get additional support around building out those supports. We'd love to talk with you about that.
So I think I'd also want to share that as we are still in this pandemic, where we are trying to think of what our world will look like now. And so one of the issues that we are now we've been trying to address, right, is how to sustain the 115 programs over the past 2 years that we've helped to become licensed, how to ensure that they will continue to be successful. And, realistically, the pandemic has hurt childcare. Where I said in the past, we've had these fissures and fractures within childcare. Pandemic has really made these giant canyons of faults in the system. And our family childcare providers are struggling. Very realistically, they are struggling. And so trying to give them the tools necessary so that they can look at their business model a little bit differently. And, you know, teleworking has been something that has really changed the landscape here in our county, and I'm sure every other county. So looking at different models that they could create in their programs, and then looking at how they can collaborate with businesses. You know, parents still have to work. And so how do we do that in a way that is conducive for the model that family childcare uses? And so that's something that we are really trying to focus on now, is helping them through this pandemic and beyond.
Great. Well, thank you all so much. We're almost at time, and I want to be mindful of people's time. But thank you to Natalie and Jennifer for your great presentations. Thank you to everyone who chimed in the chat, and Onondaga County for being willing to give an informal presentation. So great to hear more about the work you all are doing. And just really want to encourage you all to keep the conversation going. As I mentioned, we have the new Counties for Kids neighborhood. I'll send out that guide after the fact. Would love for you to continue to share your thoughts and questions there. I saw some, other questions that were addressed in the chat that we didn't get a chance to talk through. And there's just so much great expertise and knowledge and creativity in this group. So I encourage you all to continue to connect with each other. Just wanted to also thank the National Collaborative for Infants and Toddlers, a project of the Pritzker Children's Initiative, for their gracious support and partnership of this network series and of the Counties for Kids neighborhood. You'll receive an email after this event with the recording of today's session, as well as the slide deck, some of the resources that Natalie mentioned, and a survey about today's convening, and that link is in the chat now as well. Really encourage you to just take a few minutes to complete that. Your feedback is really important to us and helps to inform our future programming. So with that, I'll just thank everyone again. And please keep an eye out for an email with these resources and with more information about joining the neighborhood. Oh, and one last pitch. We have tomorrow at the same time and Monday at the same time, we'll be having our rural and urban cohorts respectively. So tomorrow we're hearing from Cabarrus County, North Carolina, where they're using home visiting to reach family childcare providers. And on Monday, we'll be hearing from King County, Washington, about their work to offer really comprehensive supports to family childcare providers. So those will also be great presentations. They're doing amazing work. So if you're interested in hearing more about what's happening in other counties, please join us tomorrow or Monday. And thank you. Have a great rest of your day.
Thank you.